Was the tourniquet let down, doctor? Yes, it was. Was the knee taken through the full range of motion to check that all is well? Yes, I did that. I think I noted that on my hospital record. Was the joint thoroughly cleansed of bone chips before you did the operation? Yes, it was. The cement, which might cause excessive wear on the new covering or joint, was a joint capsule which was then closed. Doctor, the skin wound was repaired with stitches or clips, is that correct? Yes, that is right. A tight dressing is applied to help reduce the swelling. And the drain, doctor, may be left in place, is that correct? Yes, it may be, in order to prevent fluid building up around the knee. Doctor, this is removed after how many days? After 1 or 2 days. And it is absorbable with respect to stitches, is that correct? Well, these usually dissolve and disappear within 7 to 10 days. But doctor, is it not true that it is non-absorbable sutures? Yes, they are non-absorbable sutures and clips which are removed after 7 to 10 days of recuperative effort. Doctor, were antibiotics applied? Yes, antibiotics are given during and after surgery to help reduce chances of infection of the wound or joint. Doctor, is it true that the Food and Drug Administration of the FDA is planning to create a national joint orthopedic device register to follow up the safety, durability, and effectiveness of different joint replacement devices and procedures? That is absolutely correct. And at some stage, you may be asked to consent to your name being placed on the register if you have a joint implant. Doctor, what about the gender-specific prostheses? What do you mean? That is, the traditional knees prostheses are unisex, are they not? Well, research suggests that good implant fit depends on the shape as well as the size and level of the joints specifically diagnosed or designed for women, which are now available. And doctor, these are done more closely by reflecting the shape of a female knee? Well, that is correct, and the femur component has a thinner profile and a narrower, more contoured shape. Doctor, this textured reduction, bulkiness, and as the implant does not overhang the bone and press on surrounding ligaments and tendons, is it not true that it reduces post-operative pain? Well, that is so. It also allows for the different alignment between the hip and knee that occurs in women, so permitting a more natural movement is good. What are the benefits, doctor, of a knee replacement? The knee replacement relieves pain and restores good joint movement for 9 out of 10 people. The artificial knee usually lasts 10 to 20 years before it needs to be replaced. New designs, materials, and techniques mean that replacement joints are lasting longer. Maintaining a sensible level of activity and a healthy weight helps the joint last longer still. What are the risks, doctor? The risks are general risks as well as those associated with surgery and general anesthesia. There is an increased risk of blood clots in the leg, that is the deep vein thrombosis or DVT. This is reduced by early mobilization, compression stockings, using an intermittent compression pump during and after surgery, and with blood thinning medication. Doctor, the knee may feel sore, may it not? Yes, and remain swollen for up to a year. Does the skin around the scar feel Numb? Yes, it is numb for many months and occasionally long term. Doctor, what is the excessive scar tissue formation that may restrict movement? Well, it is requiring surgery to correct that problem. The new joint may become loose or unstable, so you need a revision operation. X-ray checks at least every 5 years can detect early signs of loosening. Doctor, are there any alternatives? Yes, there is knee pain and mobility, which may be improved with physical aids such as walking sticks, crutches, physiotherapy, exercises, and analgesic medicines such as acetaminophen and or non-steroidal anti-inflammatory drugs, antibiotics, and the like. Doctor, a soft knee brace and shoe modification is a necessity? Only if it is custom made and done by a foot orthotic expert. What is an injection of a corticosteroid drug? That is the injection into the knee, which may help reduce pain and inflammation. Needle lavage, that is, the washing out of a joint with saline, can remove loose bodies causing pain. Lavage, good word, L-A-V-A-G-E, means to, in French, to wash.